celebrating and marking 10 years of changing lives in the Northeast Florida community. And part of the holistic level of care, as we were talking about just a little while ago with Dr. Bill Putnam, the medical director, is spiritual care. And that is a big part of one's journey, making it from diagnosis to completion of treatment and beyond. Joel Laton is the lead chaplain here at Baptist MD Anderson Cancer Center, and it really does kind of tie into the whole holistic center of care. You don't treat the cancer per se, but you treat the human, and sometimes that can be the most important thing. What is spiritual care all about?
Yeah, well said. Thank you. Spiritual care is, as you said, a part of Baptist MD Anderson's holistic approach to treatment. You can think of spirituality as someone's important connections that may be to God or a higher power, to the special people in their lives, to the world around us. For many people, it's the why aspect of life. What's my meaning and purpose here? And we recognize that people's spirituality, their emotional life, who they are at their core, can be impacted by cancer in profound ways. And in turn, those parts of us affect our journey through treatment. So spiritual care at Baptist MD Anderson is offered to our patients by chaplains who've been trained to do so.
And is there a specific religious affiliation or belief structure for patients?
Yeah, I say all the time that chaplains support people from all walks of life. As a matter of fact, our code of ethics includes respecting people with different perspectives and beliefs. We want to be of service to our patients, whatever that looks like. Sometimes people just need someone to listen to their story. And I believe it's a deep human need to feel seen and heard, especially if we're going through a difficult time. So whatever your affiliation, we're here for you.
And in many ways, you're treating not just the patient, but the spouse, brother, sister, kids. I mean, how do you kind of involve the whole family, and how vital is that to one's overall recovery through the process?
Yeah, it's a family affair. I say to our spouses and family members all the time that they are riding this roller coaster right along with their loved one. And we want to be there for them too, because it's really hard sometimes to be a caregiver, and they're really affected by all that the patients are experiencing throughout their treatment process. So we want to be there to support them as well.
Every year, as we hear from kids across the way who are being treated at Nemours, for example, during our radiothon, which we call Carathon now in its 11th year, we're always struck by the kids and how upbeat they are throughout the journey that they're in. And it's a different thing for an adult. How do you ensure that positivity can still come through, and how do you personally remain positive when you're meeting someone at possibly the worst moment in their lives?
Yeah, that's a great question. I think for some adults, it is the hardest moment in their lives. There's no mistake about that. But I think at the same time, reminding them that they're in a great spot. They have a tremendous care team here. My job is to be a source of hope and encouragement, to walk alongside our patients as best as we can.
Yeah, it's not an easy thing, and thankfully, you have a 4-month-old at home that allows you to decompress when you do get home, trying to maintain that balance, and probably even lean into that part of the journey for a patient as well, leaning into the good in one's life to continue to try to find that balance throughout what ends up being a journey, and not just treatment day or treatment week or the weeks. I mean, how do you try to achieve that balance for every patient that you come in contact with?
Yeah, I think our hope is that cancer doesn't define you as an individual. You're a person. You're maybe a spiritual person. You have a lot of different interests and relationships, and those things are really important. And that is the person that shows up to get cancer treatment here.
Joel, appreciate it. Thanks for what you do here. And you have a whole team. How many people are part of your team and make up the spiritual journey team here at Baptist MD Anderson Cancer Center?
We have 3 chaplains here at Baptist MD Anderson. And across the Baptist hospitals, we've got a lot more chaplains, so we're always available in the hospital too.
Well, thanks for the work you're doing. It means so much to all the patients here and throughout the system and throughout the community as well. Good to see you. Thanks for visiting with us this morning. Jacksonville's Morning News continues at 6:56.